Hello, everyone, and hello, Linda.
Good morning.
Good morning. It's a pleasure to have you in the studio, even though it's a virtual studio. And it is fitting that we be discussing a subject that is so important, so close to our hearts, and so important to our industry and organization. And it is my great pleasure to announce a book which was written. Most of it was written by you, even though I take all the credit. But
well, you made me do it.
Yeah, so I guess that allows me to take the credit.
Yeah.
And the idea of compliance, we should talk about why we started, when we started, if you remember our conversations, and why we did it. And why is it so important right now in these times when suddenly we are seeing the concerns that we had 17 years ago coming, all those chickens are coming to roost, as they say. So tell me a little bit about this book and why is it important to you? Why is it a beginning of a discussion on compliance? I don't see it as an end all, which no book should be or is.
Can't be, because the one constant we have is change.
Yes.
So it was the book was written for anybody who is concerned about who is going into medicine or who is going to be administering, or basically it's a thumbnail sketch of many different areas that of risk that people in the medical practice need to consider, whether they're in practice or they're running a practice or they're considering either. Because in school, I'm an RN, and I know that when I was in school, I wasn't taught any of this stuff, and I'm almost 100% sure that in med school, they don't go over much of this either. You graduate, you have your MD, congratulations, but you still can't practice. You don't have a license.
Yeah.
And so there are many things that need to be considered that might be considered what we would call risk. Things that you wouldn't even think about in normal day-to-day functioning, but they exist. And unfortunately, because we're clinicians and we're learning how to take care of people, we're not really exposed to the business of medicine and the things that put us and our practices at risk. So that was the basic tenet as to why the book was written. And if we go back 17 years ago as to when I started with you, you were way ahead of the curve back then, where compliance and certain things here were not mandatory at the time. And I would venture to guess that there's many in the managed care business that don't even recognize that a compliance plan is mandatory. It's a condition of participation. So basically, this book was written to provide information that isn't regular, just not regularly out there for people who need it.
So, compliance, when we say compliance, there's so many things, and you're absolutely right. We were not taught about compliance when we were in medical school or in residency. We had no idea. We had to learn it the hard way. We had to self-educate, and we had to educate others in our company. And to tell you the truth, the reason why we started it was the compliance testing, auditing we had earlier was not satisfactory, at least to me. Most of it was taken as a cover yourself approach, get an auditor to just review your billing and cursorily look at your charts and give a report, and now you're covered, you've done your compliance.
In one area. You're talking medical records. There is so much to comply. I guess the main thing is when we first met and we started doing all of this, we had completely different definitions of what compliance was because it covers so much.
It covers everything.
Yes.
Everything is part of compliance. But, even the basic compliance audit that we used to have from these consultants for 2 days did not change behavior, did not even bring an understanding to the physician, forget the auditor and the biller in the company. And so we took the initiative to start our own compliance program. And, we've talked about the challenges that you faced in the past. But let me ask you this. Why is it so important nowadays? I mean, all these news, we are hearing all these issues coming up with insurance companies. Is it important still, or is it just something like
it's more important now than it ever has been? Years and years ago when dirt was new and I chose the color of it, it was thought that audits, they were just done, they weren't done like they're done today, certainly. But once the government figured out that there was money in them there hills, there was a way to capture overpayment. There was a way to put the money back into the system by doing these things, and they became more and more possessed or obsessed with doing audits, and they need to be done because greed exists anywhere. It exists everywhere. And there's greed, and then there's lack of knowledge, and which is which. Either way, it has the same effect. And today, in today's day and age, we're seeing the headlines almost every day that major insurance carriers are getting dinged, big dings, hundreds of millions of dollars worth of dings for upcoding. And we're talking just one part of compliance. We're talking about the documentation, coding, and billing side of it, and specifically Medicare risk adjustment. So the system is inherently it is a system that can be juked if you know what you're doing. And it can even be juked when you don't know what you're doing. You think you're doing the right thing, but you're not. So it's a very new system. Medicare risk adjustment. It's only been around since 2004, and many people are just feeling their way through it. But many people have figured it out and have figured out how to abuse the system to put money in their pocket. Well, the government, having figured out where the money is and how to get it back into the system, has invested greatly in the audit process. And you'll see the headline as a result of it: major corporations being nailed.
So the biggest challenge I see is this. Most compliance programs are doing lip service, especially because they don't know MRA compliance. They don't have the expertise. And MRA compliance is a unique field. It incorporates not only the clinical side of medicine, it incorporates the operational side, the technological side, and then finally the regulatory side, which impacts your financial side.
Yeah.
And that everyone has to be working together, and it's a process in evolution. There needs to be a tremendous will to change. There has to be a tremendous depth of knowledge and expertise. All these certifications are just the beginning of it because one has to go deeper. And then it has to be driven down in a methodical, systematic manner. So what we are seeing with insurance companies, of course, we saw with the Californian HMO, there was almost an intentional attempt to jack up the MRA. Deletions were not being done. Retroactive addenda were
being written
in the charts. And then those were being billed, which was, we have been so finicky about it, about not going back. If needed, you bring the patient back and review the diagnosis, especially if you have not discussed it in that visit, or if some new information comes. And that has always been a challenge, because if you order a test and you get the result the next day, is it an addendum, or is it part of the care, or is the patient going to come back in a week to review the change that has happened?
Well,
But
if you haven't discussed that diagnosis face to face, then you can't add it.
I understand, but you are adding a confirmation to the diagnosis that you know, and what do you say? You did a special blood test because the calcium is high, a parathyroid hormone is high, and now can you do it on the phone call, because you're going to bring the patient back and discuss something that could have been done on the phone. But so we are doing things to satisfy not patient care, but to satisfy
Regulations, yeah.
a process which kind of becomes antithetical to why we are doctors and why we are taking care of patients. And much of it is silly. Just like in quality, we do things that patient doesn't need, or is no longer having that condition, and you're still insisting that they should have that medication. If they have rheumatoid arthritis, they have to have the DMARD. So at some point, this thing went out of joint. But having said that, going back to the fundamental of how an insurance company should be approaching it, a systematic way of documenting these addendums and then billing them out was obviously non-compliant. And the bigger problem with insurance companies, even if you eliminate such behavior, is how can they find out what the doctor is doing clinically, what the physician is doing? They are out there. They are not in my office. They are not even in my system. They are only getting what I'm sending.
Yeah. Well, the way it works is that there's formulas that are created to look at specific diagnosis codes, and then if you fall off the bell curve, there's going to be an investigation.
That's retroactive, right? That's retroactive, and it may not even be relevant.
Yes.
In certain populations, how are you going to use the bell curve when 70% of my population here is on some controlled substance or not? Your bell curve can itself be outbelled, if I may use, and that itself is an outlier. So how do you just using statistics is not the approach.
No, it's not, but that's how it works right now, where they're looking for smoke, and if they find smoke, they go after the fire. That's how it works.
Right, but it may not be a fire there. It may just be a smolder, or it may just be an illusion of smoke. But having said all that, the big gap that insurance companies have from practices is glaring. The lack of expertise that they have for the clinical side, which I must say they always had disdain for, is quite apparent. And there has to be a coming together of the clinical side and the operational billing auditing side. And we have to understand what we are doing clinically is important in its own place. What often we are seeing is the mindset is to twist the clinical into a different perspective, putting a circle in a square peg. What is that?
Trying to put a square peg into a round hole.
Square peg in a round hole. So it just kind of doesn't make sense. I think, at least from what I see, and again, I got certified in compliance, but I realized it is, again, it is good to know what compliance is on the operational side, but we need to focus on the clinical compliance. What is needed for the patient, what needs to be documented because it's part of the care of the patient. And that, to me, is becoming more and more apparent. Because you discuss with compliance operatives, experts, professionals across the country, and they are so focused on their HCC and ICD-9s and ICD-10s, which is appropriate for them. But we as clinicians, we are not CPCs and CRCs. We need to focus on the clinical side. We need to document what the patient is, what we see as clinically trained personnel. And then whatever comes out of it has to be addressed on the ICD-9, ICD-10 side. But we should not forget the most important thing in compliance is the patient and patient care. And that is where we have to constantly remind ourselves not to get carried away into looking at everything from an HCC side, which is a big challenge, and for insurance companies, even for us.
It's a big challenge on both sides, the auditor's side as well as the practitioner's side. Huge challenge. So and how we it comes all the way down to how we teach our providers. I mean, you can get dinged on what you're teaching them. So
you will not get dinged if you are focused on patient care, if you're focused on clinical documentation, appropriate documentation. They can come and ding all they want. I can stand on my ground as a physician all day long. You can discuss the mathematics of ICD-9 and ICD-10 and MRA, but whatever is appropriate for the patient, that is the doctor's job.
Yes.
And so to not get carried away with this kind of almost a skewed world of looking at the patient through a number, through a prism of HCC, that itself is an error. So I think what I have realized in the last few days, especially discussing with some of the leading consultants in compliance in the country, some of the leading experts, is let us be who we are. Let us follow our dharma, or our way of being, and be clinicians. Let's take care of patients the right way, document properly a way a doctor or a nurse should be doing. What comes out of it on HCC and MRAs is something that can be reviewed and discussed. We have to have our processes clean. That, to me, that is the big conclusion. And I don't apologize for being a doctor. I am a doctor, and that's why the whole system stands, because of this baseline. Because we are here for patients, because we are taking care of them, everything else comes over that. And I think we have to constantly remind ourselves, and sometimes zealously so, that this is who we are. We are not here to be coders. No. We are not here to write a code, write a certain document so that it pleases a coder. We are here to write what we see. And that is something that an insurance company, because they have been they don't know enough, they've been they're outside the clinical purview. We need to take a lead in this, and we need to say, this is what the clinical side. And we don't need to apologize for not being CPCs and CRCs, because I don't see them apologizing for not being MDs and RNs. So we need to be who we are. We need to take care of our patients. We need to document what we see and do what is appropriate. And if it fits a code, so be it. If it doesn't, so be it. And if someone has a problem with it, let's have a proper discussion as professionals. So that is why we are seeing this attempt to increase MRA without understanding the clinical side, whether by insurance or whether by different organizations. And you're seeing a lot of organizational revamp happening in primary care. Big private equity is coming in, and they're trying to make turn this into a financial outfit rather than a clinical outfit or clinical outfits. And that is where we have to be very careful to remember how to keep compliance clinical, how to go back to the basics, taking care of the patient. That is the way I understand it.
And it's a perfect way to look at it, because that's why we're here.
Yeah, as you know, the ancient Indian scripture, the Gita says, it's better to die in your own dharma than to be victorious in somebody else's dharma. And by dharma, of course, we mean our own core competence, our own way of being, our own aptitude, our own expertise. So what I really love about this book, I do want to talk about it a little bit more. It makes things simple and fun. Compliance is a very complex, arcane topic, and obviously you've not covered every little detail and every code, and that was not the point. It was, as the title says, made simple and seriously, but that seriously itself is not serious. So to make it simple, make it fun, make it less onerous and retributional. You don't do this, you get this, fear-based, greed-based, rather than making it an important part of our culture, an important part of how we see healthcare. If we want to create a healthcare of integrity on a bigger scale, then compliance fits right in. And that's where I think your book is of importance, to initiate a discussion There is no need to pretend that it is the perfect book for all times. Although, I can say this in whispers, but the great achievement of your book is you've made it fun, and anybody can read it who can read English and try to get a sense of what compliance is, and then people can do their own independent research. Compliance is going to become a low-hanging fruit. MRA, RAF scores are what CMS sees as money. We don't see clinical care as money. On our best day, in our best moments, we don't see it as money. We see it as patient care. But outside agencies see it as money. And so we have to be careful. We have to make sure our technology is able to track all the data, which most organizations, I dare say, are not doing. So technology has to be up to speed. You have to be able to look at gaps. You have to be able to validate the codes. You have to be able to reference them and see where these came from. So all that is a critical aspect of compliance, where you're even able to say, oh, I wrote all these things, and how come the health plan doesn't have it or CMS doesn't have it? So you're able to improve your authenticity, your integrity, your granular perfection if technology is mastered. And of course, operational, you have to have the data in your face day to day so you can act on it. And if there are errors, you go back. And there your bell curve might fit in, acute conditions in the office. If there are acute conditions happening, which we seldom see in private practice, then they're either miscoded or misdocumented. But this is going to be an increasing part of our life.
Yeah, and this is really, we've just basically hit on one aspect of compliance. Again, we go back to what's the definition. But, we're talking about, even you're talking about the documentation, coding, and billing side of it, but what about Stark? What about HIPAA? What about, how to write a standard or a policy? What about HR? Where does that fit into compliance? Or OSHA? In this day and age of the pandemic of COVID-19, OSHA's always been here, and we've had many discussions as we put the OSHA principles in place in the practice 17 years ago. But OSHA is very, 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 very relevant and in the forefront as well. We just don't talk about it a lot because we're in the weeds with this MRA thing and the documentation, coding, and billing. But there are many, many facets to compliance, and that goes back to what's the definition? How do you define it? So many different areas that you can fall into risk. Right down to how do you market yourself? There are regulations for that. What do you do when someone comes in with this great deal for you? What do you have to be aware of? As a clinician? Yes, you're here to see patients and to affect their lives and to make them well, or at least allow them to live well with their chronic conditions. That's your goal. But there's this whole maelstrom of stuff around you that you have to be aware of that you're probably not.
That's absolutely true. Regulatory compliance is so critical, which we are never taught, and we have over the years seen how many people got in trouble because they were either not cognizant of it, or even if they were aware of it, their attorneys, their counsel did not understand the depth of it, or they did not understand the nuances or the ramifications, and bad things happened to those doctors. And many times it was unintentional on their part, but they were punished because of overzealous prosecutors, and they lost their licenses. We've seen that so many times. On same thing with Stark law, with anti-kickback statutes, we have the same concerns. And OSHA, of course, yes, it is. Everybody in the last week or two went through this training and COVID. being aware of OSHA issues with COVID, and then we are seeing new initiatives coming from the federal government mandating vaccinations, and then we are seeing opposing directives coming from the state government mandating, non-mandating, unmandating the vaccine. So this is a big brewing battle, bigger than our small sphere, but it has a tremendous impact on how we take care of our employees and our patients. And we don't know the right answer, because if we do one thing, it contradicts one statute, and if we do the other, it contradicts another statute. And again, I think we have to go back to what is right for our patients, and what is right for our employees, and follow our own impulse to do the right thing, and have a culture of compliance, to educate people, to try to convince them, to make sure all the precautions are taken, and to ensure that they are safe. And same thing with HR. You're going to have so many new issues, of course, with the minimum wage changing, ERISA rules, and a new way of, you're seeing two ideologies trying to figure out things across the nation, perhaps across the globe, and you have to find a synergy. Certain things that are absolutely you must have, like non-discrimination, having a balanced, fair approach to everyone, non-biased approach, keeping things confidential, making sure that you have respect for every employee. Those are, I think, universals. It's when you get into the weeds that the challenge comes. But HR is as important in compliance as
anything else.
Clinical compliance or marketing. I mean, one aspect of marketing, you have clear rules in Florida how to market and how to not make certain promises, and keeping expectations limited to what is scientific and what your training is for, and that has to be something that we all have to be aware of in the company, because people can make claims, whether in the offices, whether in their flyers, whether on their signs, digital signs, and you have to make sure that you are careful. Having said that, you can definitely say what you do and what you're capable of and what you treat. But again, that balance has to be there. You can't promise results. You can't promise to be what you're not. And you cannot sell things like snake oil for an outrageous price. And the same thing in IT. IT compliance, IT security is another huge.
It's huge. It's one of the biggies. With HIPAA.
Yeah.
Whether or not you host your own servers, or how you protect your information, and oh my God, the information you have to protect. I mean, it starts with who will the patient allow you to talk to, and it goes from there.
Yeah.
With all the hacking that's going on in the country, I mean, I don't know if anybody's system is safe. So what do you do to fix that? What do you do? What is there that's out there that you can take advantage of to protect this information? It's an area. I mean, you're here to take care of patients. You're not. I'm sure you never thought, not you personally, because you think of everything, but doctors don't generally think that, oh my God, my copy machine, it's in a place where somebody can see what's laying on it, or my computer screens are facing the wrong direction. Anybody standing at the window can see the information on this patient. Or the doctor who's carrying a medical record around in his car, God forbid he's in an accident, and then all that medical information is all over the road for anybody to see. These are things we just don't think about. But they're risks, and they happen every day. Yeah. Someone is in your office fixing the lights, or doing some plumbing, We're doing some maintenance. You have medical records laying all over the place and screens open left, right, and sideways. What do you do with cell phones, with cameras? You've got employees with a cell phone, with a camera, and you're sitting in front of a screen dealing with patient health information. All of this stuff that's supposed to be protected. How do you protect it? How do you protect your patients from that kind of issue? Things we don't think about. Certainly, if you're in the ER, or even if you're in the office and there's two exam rooms next to each other, we're not thinking about what we're saying. We're so invested in what's going on in the exam room that we're in with our patient and our family. We're not really thinking about who's listening next door or outside the door. We just don't think of these things because we're so busy. We're so focused on taking care of people. And yet, that's a huge part of compliance. Huge.
Yes.
Huge. Also, I mean, something as simple as there are a million rules that circle around utilization management. We've talked so far on one side of the equation only, the Medicare risk adjustment, that funds everything. Well, we haven't talked about how we take care of our patients and how that's paid for. Utilization management and risk management and disease management, population management, case management. There are regulations that govern all of that as well. I don't think there's a single aspect of what we do on a daily basis that is not controlled somehow by regulatory guidance. Medicine is one of the most highly regulated fields in the world, of any of the fields. I think it is definitely in the top 10. I don't know where it falls within that top 10 range, but it is incredibly regulated. And that's what this book, in a very thumbnail sketch conversational way, is trying to bring about, is trying to say, you're in medicine. We know why you went into medicine. These are the things you have to be concerned about that you probably never thought of.
Yes, absolutely. No, when I was writing blogs on it, if you remember, last 12 years, I've been writing blogs, and it was not registering with people, and then they would get in trouble, and then they would come back and say, oh, now I understand what you were saying. And we tried to put all those blogs together in a primer of healthcare. And it's interesting. A lot of people, when they read the blog on marketing, what are the rules? People are not even aware. And when we put it on LinkedIn, I got so many messages. Oh my God, I didn't realize that there are these rules in Florida for practitioners, which we have all signed on to. When we became doctors and we got our degrees and licenses in Florida, we signed off on that we will not.
You also signed when you became a Medicare practitioner. When you
absolutely.
There are conditions of participation that many physicians don't know what they are, but that's what they're regulated by.
Yes. So maximum response I got on the marketing compliance. This was about 8-10 years ago, and people, even administrators at a very high level, were not aware of these laws. There are about 10-11 laws which were put up actually in a book on marketing compliance, I think by Lester Perling. And then we referenced to it, and we took out the clinical.
Actually, those excerpts are in this book. They gave us permission to reprint. So that whole part, that most important part from Lester and Alan's book is in this book.
That's correct. It is just bringing to light things that you don't know, right? The known knowns and the unknown unknowns.
Well, as the letter says, when you get one from CMS, God forbid, you knew or should have known. The ostrich approach just does not work. It does not work. Your ignorance is not bliss in this case. Yeah.
So as we come to almost the last quarter of 2021, having learned what we have learned and having done what we have done, are you proud of what you have accomplished in the last 17 years?
For Access, yeah, I am. I'm very proud of what we have built together. Very proud. But what I know is that I don't know everything. It's because things change, and they change so quickly. I mean, October 1st. We got a bunch of new ICD-10 codes. We got things going away. We got things coming in. We got stuff changing. If you don't stay on top of that, if you don't have your thumb on the pulse of what's going on, boy, you will be that ostrich. You will be the person with the head in the sand. But to say, do I feel like we accomplished something? Oh my God. I think I earned this.
Right. So what you have accomplished is the very fact that you can look at new things and discuss with some of the best experts in the country, sit at the same table with them and talk to them about these issues and have an intelligent conversation and bring forth the clinical perspective, which most of these experts don't have the clinical perspective. So my simple statement about this change on October 1 about one billing for one diagnosis is I really don't give a tinker's damn what change happens in the HCC coding, some arcane coding. I have a patient here who has heart disease or a stroke. Am I going to test for a certain condition and treat it?
If it's relevant. If it's relevant to that patient's care, yes.
That's it. And that's what my focus is. Whether it comes to an HCC code or not come to an HCC code, I'm not an expert, and that is not my consideration.
But it shouldn't matter. It shouldn't even come into the conversation.
Right. So I don't worry about it. Let me do my job as a doctor. Let me make sure I don't make any mistakes. How other things impact this space of patient care. Make sure there is HIPAA. There are no HIPAA violations. Patient ID, no ID theft. Nobody's stealing domains. Nobody's taking our stuff from us. Make sure we give them proper respect. Every employee is empowered. HR is focused on human development and talent. All those things are important. But when I'm taking care of the patient, once all these things are taken care of and I'm in that safe space, then I focus on the patient. And so I think that is how this is my realization for the last few weeks. Let me take care of the patient. Let me document appropriately what I see, what I feel, what I palpate, what I auscult, document clearly up front, and then whatever it comes to, it comes to.
Right. Let the chips fall where they may.
Yeah, I think eventually integrity in healthcare, integrity, whether it's personal, whether it's professional, whether it's organizational, that really is what compliance is. And the willingness to comply has to be always there. And then you can adapt. If you're always willing to comply, you can adapt to all the changes and you can be ahead of the curve in all aspects, whether in patient care, whether in patient safety, whether in organizational safety, whether in staff development, all that is taken care of.
Yeah.
So I think that is my conclusion. And I thank you for all these years of hard work that we have done. I remember 17 years ago how skeptical you were when we were trying to develop this program. And I can see that you're still skeptical.
Well, some things never change.
But yeah, I think only the paranoid survive, right? So you have to be constantly.
That's a new one. Only the paranoid survive.
Yeah, it's a famous book. Intel's CEO, I forget his name, Andy Grove wrote this. And you have to be. I like to insert only the creative survive, or only the compliant survive. That should be our motto. And I think if you think about it, it is very true. If you're compliant, if you're creative compliantly, then you will survive. So I think with that, I would like to end today's chat. And I think we have accomplished something we can be very proud of. And then we have to keep building on it because it's an ever-changing field. It's like that Harry Potter's what was that castle where things keep moving? The stairs move.
In Hogwarts, yes, the stairs are always moving. Yeah,
Right.
You take a different path every 5 seconds. It's a different path. How interesting, yes?
Right, but you're always given what you ask for. What is that? If you really ask for something,
be careful what you ask for. You may
remember,
get it.
it's in that. So, Compliance Made Simple, seriously, by Pariksith Singh and Lynda Dilts Benson. I think it's an amazing accomplishment. I'm very proud of it, and I think if we can at least bring that spirit to more and more organizations, we would have done service to our patients and fellow professionals. Thank you, Lynda.
Thank you, sir.
And with that, I will take your leave and hope to see you soon and have more discussions on compliance.
Yes, sir.
Thank you.